The treatment of prostate cancer depends very much on the risk of the cancer to the individual, and also to a degree as to how old the individual is, how much life expectancy is expected, and how well the patient is. So all these things are taken into account. If the patient has low-risk prostate cancer, we're very likely to recommend observation or watching, or something called active surveillance. We offer this because the risk of the prostate cancer is very small indeed. In fact, the likelihood of dying of prostate cancer is exceedingly low. And so we just keep an eye on things. And usually we just watch a low-risk cancer and make sure that it doesn't transform into something more clinically significant, which is an event that's very rare indeed. If the prostate cancer that's been identified on the biopsy is deemed to be clinically significant, so in other words, it could affect either the quantity or quality of the life that's left for the individual, we would recommend treatment. And treatment traditionally is in two parts. One is removal of the prostate and the cancer within it, or radiotherapy to the prostate and the cancer within it. These days, we've also got alternatives which are less invasive and better tolerated. And in some individuals who have a small cancer, if usually seen on its own, they can be offered a treatment called focal therapy. If we can identify the tumor, we can see it clearly on the MRI, and it's verified on the biopsy, it's usually fairly straightforward to treat with an energy source, either heat or cold or electricity. And that's done as a day case procedure, although it does require a catheter for a couple of days. Very rarely, when the cancer is diagnosed, we find that the cancer has spread beyond the prostate. This happens less and less these days, and typically men will present with PSAs in their hundreds, and when we do a scan of the rest of the body, we find evidence of prostate cancer either in the lymph nodes or the bones. These men will require what we call systemic therapy, in other words, therapy to the whole body, usually with medicines, and these take the form of hormones and or chemotherapy agents, and increasingly these days, drugs that help the immune system deal with the prostate cancer.